Hai, hello, Assalamualaikum semua. Kembali lagi kita ke Sembang YoungMinds, di mana kita akan membincangkan banyak isu-isu mengenai kesihatan mental, mengenai self-care dan self-growth. So, setiap minggu kita akan bawakan experts dalam bidang kesihatan mental dan juga orang yang pernah mengalami isu kesihatan mental tu sendiri. So, we are talking about people who have real life story. So hari ini dengan bersama saya Izzat sebagai host anda, kita akan bersama dengan seorang yang bagi saya memang passion dia dalam mental health kita tak boleh nak sangkal lah. We have here together with us Dr. N. She is a lecturer, a counsellor, a clinical psychologist and also a public health expert. So dah berapa tahun dah Dr. N dalam bidang in public health and also mental health ni?
Okay, kalau kira public health tu dah over 20 plus kot.
Dah 20 plus years.
20 plus years. Yeah, I'm pretty old if you want to know.
Itu dah lebih kurang umur saya dah tu.
Definitely a lot older, you get the price. We shall not go there.
Okay. So maknanya dah lama lah, and I think I can see that is your passion, and not just dalam, maknanya bukan sahaja dalam bidang research. You have, I believe you have conducted a lot of research, but also your clinical skill, your clinical experience pun banyak juga kan?
Right.
And today actually we want to talk about social anxiety, and I think benda ni, topik ni something yang ramai orang experience. It's not something uncommon, and especially in younger generation lah, in youth. We're talking about youth.
Correct.
Benda tu I rasa kalaupun bukan, let's say like we will talk about social anxiety disorder, tapi if it's not a disorder, kita semua pernah rasa.
Right.
Zaman kita belajar dekat universiti dulu kan, nak present menggigil-gigil kan.
Yeah.
So let's go deeper lah into social anxiety. Apa sebenarnya bila kita sebut perkataan social anxiety in a social setting, what is it?
Okay, thanks Izzat, and thank you YoungMinds for inviting me today lah for this podcast kan. Hopefully insyaAllah apa yang saya share ni boleh dimanfaatkan lah. I try my best. Dari segi social anxiety disorder kan, before we go into disorder itself, let's talk about social anxiety. Social anxiety ialah kebimbangan yang melampau dalam keadaan situasi sosial. Sebagai contoh, kalau macam berdiri di hadapan halayak orang ramai, kalau macam kita kata budak-budak kan kena present, ataupun university students lah. I'm sure Izzat you've experienced this when you were a student. I experienced it when I was a student as well, especially Malay students. At that time I was overseas. Obviously orang lain, you can see they have no issue talking in front of even your colleagues or in front of the class, 100 people. They have no issue about that. But we have so many issues that you think about, oh, my English is not good. What if they laugh how I say things? What if I don't present well? What if, people are judging the way I dress? So many things that goes through your mind that makes you constantly worrying about how you perform. Okay, that's in, if you like macam nak present something lah, if you are supposed to explain something to someone, or even if meeting new people lah. Setengah orang kita kata, oh dia ni malu lah nak jumpa orang baru. But to what extent malu to become a bit extreme and a bit severe bila masa you avoid meeting any new people, and you avoid going into social events. Maksudnya kalau ada get together ke student, kan selalu buat macam get together, meet other new students.
Event apa, minggu ta'aruf.
Ta'aruf,
kan,
we call him freshies lah kot. Ta'aruf tu very Muslimah. Freshies kat sana tak ada lah ta'aruf kot. At that time, freshies, we mingle lah. We mingle with our seniors kan. You avoid totally because you're so scared to even start a conversation. You don't know what to say. You don't know how to behave. You don't know macam, what if people are, looking at you, judging you, budak ni daripada Malaysia, mesti tak pandai cakap English or something like that. In your mind, that plays because you are not in a situation that you're familiar. So even here, even as a student kat sini pun, I rasa when you're in a new environment, you feel that, oh, I have to meet new people. I tak kenal siapa pun kat sini, and then my classmates, and then we have to present. what if they think I'm stupid? What if they think my questions is dumb? Or what if they think that I ni asal daripada kampung-kampung datang kat sini, questioning my background ke? It's so many things that makes you so worried about being in that situation that it becomes so severe that you avoid it.
Okay. So maknanya tadi bila doktor kata maknanya it's normal that we are scared kan, we feel scared, anxious bila dengan orang nak kena present sebab kita nak tunjuk lah the best version of ourselves kan. But when it becomes a problem bila kita start avoid, kita start tak buat.
Correct.
And how do we say macam benda tu dia boleh jadi sampai satu disorder? So other than avoiding, what makes it sebenarnya more severe than itulah sampai dia jadi satu kecelaruan lah.
Bila to that point that kita pun experience physical symptoms. For example, I know kan orang kata do you feel butterfly in your stomach ke tak kan, bila perut berkeroncong, time tu lah bila nak present tu, time tu lah nak pergi toilet lah, nak
Betul,
apa lah kan.
yes.
And then your heartbeat started to kind of like dap dup kan, and you feel your hands started to sweat, shaking, and then hands are cold. Okay, right now hands are cold I think because aircon cold, and hands are cold. You feel all of these feelings in your body, and then you feel like to the point that okay, you can't go through with it. You cannot go through with the presentation, or you cannot go through with attending a social events because leading up towards it is already causing you a lot of disturbance.
Okay.
To the point that okay, your perut dah geroncong dah, memang sakit-sakit macam nak pergi toilet sangat-sangat, and then your heartbeat dah dap-dup, makin lama makin kencang, makin lama you sampai to the point that if it gets really bad, you rasa macam you kena find a place to sit down. And the more you try to push, the more it just gets worse. Where it stops you from doing the things that you're supposed to do, or it stops you from basically doing things that is like normal things, like going to school, going to university. It stops you from doing that. Then that's considered to be debilitating. That's considered to be the point that need to do something about this.
Time tu lah sebab dia dah start, because it started to become a big wall in front of you from you getting what you want kan in life kan.
Exactly. And it's disabling as well. I think that's the most important thing.
I think that's the word kan, disabling.
So seolah-olah you kurang upaya. You cannot, meaning that you cannot do the things that normally you used to do, and you cannot do that anymore because this constant fear of beating people, going out there, putting yourself out there, it's constantly affecting the way you think, the way you feel about yourself, and the most important thing that is causing some physical symptoms as well.
Bila doktor kata tadi macam berdebat-debat, benda tu normal je, kita nak rasa, tapi tak adalah sampai kita tak nak present, kita still present. Suara menggigil ke apa, kita still buat kan.
Correct.
Kita takut nak pergi jumpa orang for the first time pun, but we still do, and then we get to know people kan. So when that stops, our life becomes macam, I can imagine it becomes very constricted.
Yes.
Kan? We are just there, we're not going here, we're not doing anything. Sedangkan I think we're, humans are social animals. We need people in our life kan. So when you mentioned tadi kan, it stops you from getting something, and especially like we can see that some people dekat university benda tu I think in some cases juga, I think it's common to see youth berhadapan dengan social anxiety kan.
Right.
But what age does it start? Does it start early, or is it when they started entering a different situation, dari sekolah ke university baru you have the social anxiety? So what could actually lead people to experience it?
Okay, there's been several researches lah that's been done on this kan. It can be many different factors. Some people, it can be since childhood kan, you notice them a bit shy, a bit timid, tak campur main mainly by themselves. They like to spend more time by themselves, and they avoid social situations, being in a group ke, or presenting. And it's not a problem because again at the end of the day, tak adalah affect sangat sampai tak nak pergi sekolah ke apa. At that time maybe parents pun paksa kot, because parents kan, alah he's a little bit shy, tak apalah, dia pergi sekolah nanti dia okay lah.
Itu kira temperament je ke maknanya?
At that time we cannot determine whether or not it is their temperament. It's just that their personality, or it's something else? Because children kan, it can be because they're developing kan, so they're still trying to figure things out. So parents mungkin tak nampak lah that it actually can lead to them having that social anxiety when they start moving into, let's say, secondary school. That secondary school, when image, self, how they present themselves, how they see others, actually have an impact on their own self-esteem, self-confidence, and that's when it started to show a little bit more lah. And then if there's nothing is being done, masa dah secondary tu, they're just becoming more withdrawn because of this anxiety. If nothing, if parents doesn't pick up, then it's just gonna get worse, because sometimes parents ni bukan nak kata lah, they're not aware. They just simply brush it aside. You know, why don't you want to go to school? Why don't you want to go to uni? Alah, uni sebenarnya malas je. Apa nak takutnya sekolah kot? Bukannya apa kan? So at the end of the day, they feel like, okay, whether I like it or not, I have to go. They have to push themselves to go. So they're just surviving based on whatever they can lah, just facing it. But it doesn't mean that it's going away. Because that constant pressure from family lah, whether you like it or not, I'm pretty sure your family, my family, ada expectations kan, especially on the academic. They will force you to go. They will force you, okay, you kalau tak pergi sekolah, jadi apa? Macam tu lah kan. So nak tak nak kena pergi sekolah. Padahal mungkin budak tu tak nak pergi sekolah because they feel anxious building up. Going to school, and then they come up with all kinds of excuses tak nak pergi sekolah. And it can also be that it's not just anxiety is one thing lah, because you are exposing yourself to other people. During secondary, to be honest, there's also bullying as well, where they are constantly being subjected to verbal abuse or social exclusion, which
kena pulang dengan kawan-kawan.
Perempuan is notorious lah. Budak lelaki they're a bit more external lah kot, I rasa.
Budak lelaki can be more aggressive.
More
Perempuan
aggressive.
ni biasanya main psychologist kan.
Dia very silent. Silent punya
jangan
treatment.
kawan dia,
Jangan kawan
jangan
dia.
ni,
And
kan.
now with social media kan, it can be that you're not wrong in thinking that people are judging you, because with social media they can create WhatsApp group where you are not involved in the WhatsApp group.
Tu sakit tu. Tu sakit
That's
tu.
even more worse. You know they're talking about you. So you're not wrong in thinking that you're anxious because people are judging you.
But it's actually happening.
It is actually happening. It's just that you don't know where all of this happens. You just know that people are avoiding you and people are looking at you, people are judging you. That heighten that social anxiety. Because if you put yourself out there, you know people are already judging you. It's just going to make it worse. So why would you want to?
So kira macam you because of your experience tu, mungkin it can also be like a person, not tak tahulah, personality belum develop, tetapi maknanya mungkin sikap dia memang pemalu apa semua,
Right, betul.
Tetapi it can also be other factor yang luaran juga, macam pengalaman kena bully kan, ataupun macam tadi lah, parents dia tak sedar dan you have no intervention in terms of how do you build your social skill when you don't know what to do kan.
Correct.
I see.
True. And then at the same time, what was I was thinking? At the same time, this social anxiety is so debilitating that they refuse to go to school. They don't want to go to school, and then parents pun tak tahu what to do. How do I help my child? And then the child pun tak nak cerita. Kan, kids kan, because obviously they don't want parents to get involved. And this feeling, especially kat secondary kan, adolescent, young adolescents kan, they want that sense of belonging. They want friends. So they try to fit in. But if you don't fit in, that means you're out lah. And that makes it worse for them. And that's the time, I don't know about you lah, but secondary school, I always remember, and everything that happens during secondary school really affected you as an adult. You boleh ingat lagi masa you 16, 17 what happens, even 13, 14. If you remember during that time you didn't have a good social punya experience, that would definitely spill over to your adulthood lah, when you're at university as well. Because remember what Erickson said dalam kita punya psychosocial development, kalau you tak fulfill, achieve one level it will spill over to the next level.
Dia akan stuck dekat situ, dia akan create more problems.
Correct. And this is what's happening now lah. Like for example, kalau you kata ada external factors, COVID. Okay, I'm just going to go straight into COVID. COVID doesn't help. I mean, it helps people to, okay, alright, you start university. Kan? First day university dah COVID. Your classes
cakap
semua
dengan kawan-kawan, tak sempat nak berjumpa.
Tak jumpa pun, you tak tahu, but everybody's on virtual.
Tahu nama je dalam Zoom tu kan.
Tak pernah jumpa, and then you have to do group work, apa semua online, which is fine. And then if you already have like a bit of anxiety, imagine in your third year, you've been in the course for 2 years, tak pernah masuk campus, that first day stepping on your campus, first time in your life, first time for your class physical, you will definitely have anxiety. Because you already formed that, okay, I can go with them online, but what if they see me in person? What if they judge me on the way I look? What if I don't fit? What if? So then that started. Then, then that constant worrying about how people would accept or not accept, that gets, transpired during that time when you're on campus physically, which definitely will affect. And this is something that some of my clients experience lah. And they express their concern about, what if my classmate don't like me? What if they think I'm weird? Because I've only known them online. We've only talked to each other virtually. Some of us tak pernah tengok pun how we each other look like, So stuff like that lah.
So it comes back to sebenarnya we want that sense of acceptance. So kalau daripada our own experience, especially yang doktor mention awal-awal tadi kan, when you are already being outcasted at any point of your life, masa sekolah menengah, kena pulau, kena ketepikan, and then you've been judged, like I mean, we grow up, kita tak lari daripada judgement lah kan.
Correct.
And so those kind of experience dia boleh maknanya build up, and maknanya if it goes to a point yang kita tak boleh nak buat apa yang kita nak buat, macam study, dah disturb study, dah disturb kerja lah, contoh pergi internship pun tak boleh nak bergaul dengan orang, bercakap dengan orang, rasa susah. So itu yang kita kata dia dah jadi tahap disorder lah. Disorder tu kan,
correct,
our life is disordered dah.
Exactly. And then if you're throughout your life you still able to manage lah, let's say you're still able to cope, okay, there's going to be one point where you're running on fumes, meaning that you have nothing else. You have nothing else to push yourself in terms of coping. You use all your energy trying your best to hold all of this anxiety, anxious energy, as we say, because you're constantly worrying. That takes a lot of energy, to be honest.
Rasa berdebar apa semua tu pun penat lepas you berdebar kan.
Exactly. Where you come home, you rasa macam you just ran a marathon. Imagine doing that on a daily basis. You're running a marathon on a daily basis, constantly holding your anxiety in, and then just trying to, like, how do I say it? Fake it lah. You're
masking, right?
You're masking it, you're faking it. You try your best to make it. Day to day is a struggle. So one day, something will break. As we say, something broke the camel's back. And that's when plump, everything just become worse. I think the previous speaker pun ada mention lah, one day something just broke and it just goes downhill from there onwards. And it's the same thing with social anxiety as well. One day something broke, you just don't even want to actually go out.
Dah limit you dah.
Exactly. You cannot, because you're running on fumes already. There's nothing left to give. You used up so much energy, your whole life. And it comes to the point that it just goes downhill from there onwards.
And it's uncommon. It's uncommon to hear they can also develop depression juga kan, from social anxiety.
Of course. When your life just flash, around you, thinking that I just don't feel good going out. I don't want to meet people. I don't want to go to work. I can't do this. I can't do that. It's very debilitating. Then you start questioning, then what should I do? I feel so hopeless. I feel like there's no purpose. Why am I doing this? Why do I even bother?
I try. It's hard. I failed again.
Exactly. I tried my best, but it just doesn't seem to be going my way, or it's just not going as my plan. I just cannot do this. It's a struggle, and every day, and it's exhausting. Then you started questioning again, why do I bother fighting every day? I might as just like end it. It's like, it's too much. It's too exhausting. It's too tiring. I can't do this anymore. Just let me just go in peace, or let me just end it like that. So the thoughts of, hopelessness, the loss of motivation, the fear of, no point in life anymore. So those are like depressive symptoms. On top of that, with anxiety that goes together with it.
That never stops kan?
It never stops, and it's just too much.
Yelah, I tak boleh nak bayangkan macam mana kita nak live life without actually meeting people. We have to go out, we have to do something, we have to work, we have to...
Exactly, you have to survive.
And you're missing out on, probably you can learn something, but because of the anxiety, it stops you from growing kan?
Exactly, and you look at life as if it's all doom and gloom. There's nothing worthwhile. There's nothing worth living for, because this is what life has given me. I can't do anything. I can't see myself getting out of this. I don't feel any hope. So I've tried. It's done. Can't.
Yelah, can imagine lah if it goes on for a very long time, like you said, dan dah sampai tu tahap dah penat. Memang, saya dengar pun, I'm trying to imagine. I cannot, it's hard to imagine lah how tough it was for them.
Yeah, it is, because this is the things that I do see, and I think us as a clinician, as a counselor or a clinical psychologist, when we empathize, we really have to feel as if we are in their shoes. And that's why I do feel in a way that I kind of understand what they're going through. Just trying to find that simple analogy lah, like macam I kata lah, it's like running a marathon on a daily basis kan. So if we can't be in their shoes, we try to imagine what we've gone through that feels somewhat similar, maybe not as the same, but we can feel how the fight is like, how do I say it? It's like, it's a struggle that never ends, and it's hopeless. What are you fighting for? What are you struggling? What do you fight for every day? At the end of the day, you're just going to come back feeling like how you feel. And is it worth it? Is it worth going through life like this?
And I think they've tried. Definitely they've tried so much kan. Bukan diorang tak buat apa-apa, diorang dah cuba. Tapi itulah, I think as we grow up, makin lama makin susah. Especially in social setting, you're expected to already know certain things, to already be able to do certain things kan.
And if your job demands you to do that, then unfortunately it comes as part of the job lah. Therefore your performance affected, macam previous speaker cakap kan, affected the performance, and you cannot do the things that you're supposed to do because that's part of your job. So then they will say, you ni tak reti buat kerja ke?
Lagi banyak criticism dapat.
Every time I assign you something, you never get it done. You're always missing from work. What is this? I hired you for this. So there's a lot of negative connotation related to it. So it kind of really reinforced the thought that, okay, now I'm useless. Now I can't do job. So it's like self-fulfilling prophecy.
I'm right
as well.
kan? I'm right. Whatever I'm thinking, it's right. Correct. It's happening.
Exactly.
Memang aku ni tak guna. Memang, I can't do this. Presentation pun teruk.
Exactly. So it is a vicious cycle. It never ends. So in order to end it, that's it. I'm done.
So the question is, Ken, what is the alternative then? Kalau betul lah orang yang memang suffer dengan social anxiety disorder, how do they end that vicious cycle? What can they do? Or maybe your experience as a clinical psychologist kan? What are the treatments yang memang actually is seen to be helpful? Dan seteruk mana pun orang tu ada social anxiety disorder ni, there are ways for you to get out of that cycle.
Right. I think first thing first is to accept the fact that you do have the issue. You are facing that. We have to accept lah, this is our condition, and to accept that is to also find ways to help yourself. So let's say most of the time people, you feel like I can still handle it, I can still handle it, but the people around you can see that you cannot handle it kan. So if your family or your social support are aware that you are struggling, usually they would take you, they would tell you like, look, you're not doing well. We are worried about you. Is it possible for us to take you to see someone? And really push for it lah. And at the same time, if they are aware, they can also seek help. But obviously, I think at the end of the day, they themselves need to want to be helped. They want to actually do something about it.
They need to reach out.
Exactly. And
if they're running a marathon, they need to reach out to someone and say like, I'm so tired.
Yeah, give me something. Help me stop this, and that's very important because most times people deny they have any problem. Second is they don't have the will. To be honest, when you're debilitated kan, macam ni lah, disabling kan, you cannot think. You cannot think. That's why awareness about this is very important, where kita encourage people around to be aware of the signs and symptoms so they can help. That's one. And also for those who are suffering, those who are experiencing it, to reach out when they identify that they have the symptoms. I know it's a struggle to get out of the house. It's even difficult. Some of them yang memang tak boleh keluar rumah langsung kan. It's okay. You don't have to actually go to a center to actually get help. We can do it online first. Because we do have social media. Sekarang through online platform like not Zoom lah, Teams ke whatever the center provides kan, you can actually start talking to someone at least to sort of work through the root cause of your social anxiety first. All of this negative connotation yang you ada dalam fikiran you, work through those things first. And then for us, there's many different techniques lah that we can use kan. But baby steps. What are the things that we need to help you identify first? What are your triggers? What are the root cause? Therapy is definitely one way lah. And then at the end of the day, from online, we can slowly move towards physical. This is also baby steps lah that people can take to help build up that confidence in facing social situations, to be familiar with the fact that it's not as catastrophizing as they think it will be if they go out and see new people. But again, slowly, baby steps lah, as we say. And it's not all doom and gloom that they think so. So that negative connotation, the thoughts, the unhelpful thinking style tu, kita kena help them identify and work through that first lah at the end of the day. And then we work towards what is the root cause of it? Why did it happen that way? It could be macam you cakap lah, it could be something that happened in their past.
Could be the traumatic experience.
Yeah, exactly. So we need to work those things through in our therapy sessions lah.
Faham. So kita, yang penting sebenarnya kita faham, we understand why do we experience these symptoms?
Right.
What happens in our life that led to this? So we want to understand our own case kan?
Correct.
I think like even if two people is diagnosed with social anxiety disorder, dua-dua ni definitely it's not going to be the same exact treatment kan?
Correct.
It's going to be different based on apa yang diorang experience sendiri kan?
Betul. That's why it's customized lah. Kita tengok what does our client need. Sometimes we just need to explore. Sometimes as a therapist, as a clinician, we're just there to listen. We're just there to validate. We're just there to understand and empathize. Maybe all this time it was a struggle that they think they're just on their own. That's the thing. Most people rasa dalam situasi ni they are on their own. They have to deal with it by themselves and they have to find solutions for themselves, which is not a right mindset lah, because at the end of the day you only know what you know. That's why you need to see someone to get a different perspective. And you also need to get some support from your social. If you hide it from your family, you're hiding it because you're shameful ke, or you've already painted a picture that you are this strong person ke, apa semua, and then telling them that you are dealing with this issue or you're having this disorder, they would look different, judging as well, right? Kata lah. And that close a door for you to actually get support from your family. So for me, first things first is that if you have a family, get your family to understand and get their support, because in any case, this is not just you alone. This is involve your social support, your family, and also it involves you to put in the effort to make that change in order to be better as well. That commitment kena ada. So it's like it takes a village juga lah to help a person, because they're not alone. And this is the mentality that we need to change as well. It's not just for social anxiety, but it's also for other disorders as well. People need to stop thinking that they're alone in this. So if you feel like you're alone, you tak nak discuss it with your family, then discuss it with your therapist.
Okay,
your therapist will be there for you throughout this journey of, improving or working throughout your issues, your challenges, your experience, so that you have somebody you can actually turn to whenever you do have these difficulties.
Okay.
And this is our job lah, to put back that therapist punya hat kan. We are, every time we sit in a session with our client who's going through something, we are in that journey together with them. They're not alone. And that's something that as patient or as client, to understand that you cannot do things on your own because you don't know if you're doing it right or wrong.
Betul.
Kan.
You need feedback juga. Kan?
Yes, you need guidance.
If you're improving or if you're stuck somewhere, you have someone yang akan tolong juga.
Exactly. So macam kita kata lah, bulan Ramadan ni bulan mulia kan. Selalunya kita belajar baca Quran kan. Kita dengar dalam YouTube, kita baca. That's why they say nak belajar Quran ni kena ada berguru. Because bacaan you ikut YouTube, orang tu halaqah dia lain, you baca halaqah dia lain, mungkin betul mungkin salah. Daripada you buat salah, baiklah you berguru. Because guru tu adalah orang yang lebih arif dan lebih tahu untuk macam mana nak ajar you. The same thing, kalau you test and try things, at the end of the day, if it doesn't work, then you say, this is not working for me, so why should I go for therapy? So that mindset need to change lah. So you need that other person to be in that journey together with you. That's very important.
Do it with someone.
Yes, correct.
And I think it's interesting when you mention family support kan. It came to my mind macam ni. Kita nak dekat, kita dah musim-musim raya ni kan.
Ya, betul.
I rasa one thing lah, kadang-kadang menakutkan waktu musim raya ni nak pergi rumah orang is the, like you said lah, sometimes we go out with comments.
Right.
Ataupun telah kan, makcik-makcik bawang punya mulut
betul,
apa semua tu. Benda tu sebenarnya boleh effect tak? Like growing up with, getting all those comments, being questioned or being told as if macam kita ni kurang kan. Contoh pergi balik somewhere, let's say lah, take my example, my personal example, I've been married for quite a while tapi belum ada anak. That would be one of the thing that I would be uncomfortable. It doesn't create anxiety, tapi uncomfortable. But for some people, benda-benda komen yang they get like from families kan, kenapa tak ada kerja lagi, kenapa macam ni, kenapa itu, ataupun kenapa tak behave ni, duduk elok-elok ke apa. Growing up with that kind of, I'm not sure if this is cultural or it can happen, just anywhere. But can that contribute juga to?
Oh, definitely. I don't know how debilitating that can be lah, because all these makcik-makcik yang selalu membawang kan, and also being nosy lah at the end of the day kan, because if you're single, they will ask you, you ni dah ada power ke, dah ada girlfriend ke, bila nak ada kan, sampai
umur
bila nak single,
berapa, tak ada lagi
ni,
nanti
dah berapa
dia dah tua ke.
Exactly. Perempuan lah lebih banyak. Lelaki dia tak kisah sangat, because men's life starts at 40
men
kan.
kerja kot kan. Kalau tak ada kerja mereka kena komen kan.
Yeah, freeloaders and whatnot. Because people are always going to comment lah. But to the point that it become too much lah. And at the end of the day, they start comparing you with your cousins lah. Tengok tu, dia ni dah kerja sini, apa dah kahwin, dapat anak apa semua, kau ni seorang-seorang bila lagi kan. Mak kau tak bising ke? Orang kampung pun cerita dah. Orang kampung pula. So the whole village knows about it, right? That I'm single and I'm old and I don't have a partner. Macam tu. So when you think like, now it's not just your family, everybody in the kampung knows about it. So next time you nak balik kampung ke? Of course tak nak kan?
And you tak selesa pun duduk. It creates you anxiety. Alamak, macam mana ni nak balik kampung ni. Habislah nak kena hadap orang-orang punya mulut kan.
And you definitely come up with excuses not to balik kampung. So because then you start to build up your anxiety.
So macam mana kita nak ubah landscape ni? Because I think macam tu lah, I've seen clients ataupun cases with social anxiety sometimes because membesar pun they get compared a lot. They get told yang macam all whatever negative thing yang ada dalam kepala tu kan, people are judging, is actually happening to them.
Yes,
kan?
yes.
Membesar macam kau ni kenapa tak boleh nak buat dengan baik lah, kenapa macam ni, tengok orang lain tu boleh ni. So those comparisons. So it's we can think like it's normal for you to react, to think that way if you grow up like that kan.
Yeah, betul.
What can we do to change this landscape lah, of having, I think lah, I cannot say if it's a cultural thing, but I feel like more in the kita punya eastern side ni kan, yang di mana kita ni is being compared a lot with others, and that could hurt us growing up.
Right. I think what we can do is that as the upcoming new generation lah, these are mainly older generations lah. I know my grandparents, my grandmother, my parents pun dah tak ada that sort of mindset to apa orang kata compare the cucu-cucu ke apa, tak ada. And I like that. So for me, my generation is that we don't compare. I never compare. I don't like to compare because I grew up with that feeling of being compared with my cousins, and that's something that I grew up with to the point that I felt this is my own experience lah. I felt so bitter towards my grandmother. Obviously at that time, yelah muda kan, kita pun tak fikir kan, to the point that I put a stop to it. I said, please stop saying that. Please stop comparing it. And I mean, it's not nice to talk about those people that pass away kan, but she told me that, okay, then, you know, if you hate me so much, then once I'm dead, tak payah datang to my pengebumian, like my burial lah, which I didn't go when my grandmother passed away, and that's something I regretted lah. But at the same time, I don't agree with the way she does things lah. Like growing up, constantly being compared. Nothing you do is enough. And this is my grandmother. Thinking about it is really funny lah, but the impact of it still has up until now. So for me, my way is that we need to create that awareness that it shouldn't be that way, that we cannot be that way towards our children, towards our grandchildren, and that's the way forward. We can talk about it with our parents that we shouldn't be doing this because it does affect them. It's something that they don't need.
Kita kena advocate sendiri.
We advocate, we create awareness, so we discuss about it. So for me, that's our part. Even though it's small part, it makes a lot of difference if everybody doing the same part.
Betul.
That's for me, it's the way forward lah. And other ways is, I think, creating awareness at the national levels and whatnot. That's something that, you know, a lot of NGOs, a lot of maybe government can do something about it in education ke apa ke kan. So that's at the stakeholder punya levels lah. I guess in terms of individual capacity, that's what we can do lah to make a difference. I always believe that way.
And I think it's everyone's role juga kan, in helping. Itulah when we are more, kita ada lebih empathy,
right?
Empathize with others. We can try to think of, instead of trying to judge, we listen first kan.
Right.
If someone is not acting macam biasa ke, like in school, our children ke apa, then instead of telling like, oh, this is how you should do, then we ask, what's happening that's causing you to feel this way kan, feel scared. So then bila kita dah dapat identify, masa tu lah kita boleh be the one yang membantu kan.
Correct.
Sebelum dia jadi lagi teruk, membesar dengan social anxiety kan.
Yeah, be open and be acceptance, and then just be, I guess, just be there for them, you know, and know that they can lean on you as a parent to talk about all of this stuff. And I think that's very important for us parents to also stop putting so much expectations in our children, especially academic wise, and start comparing our kids as well, because it actually creates that anxiety on them where expectations are unmet. And that creates that, I'm not good at this, I'm not good at that. Even my parents say so, which is not really good. So I think as parents, we need to celebrate whatever our children punya achievements, and to let them be what they want to be, because at the end of the day, there are kids. I have kids, and I know, so I never put pressure on my kids. Kata, do whatever you want, man. Whatever makes you happy. I have no expectations in that sense. So they're all very okay in terms of they talk to me about a lot of things, even schools, crushes, you name it, like every single thing. And I feel like at one point, that's pretty good. I'm very grateful. They're very open in that sense. But as a parent, you can be biased. You got when you hear too much things happening as well, then you kind of wonder what's going on in the school and how can you help your child, and how do we help other parents to help their children as well. So environment at school pun kita kena advocate juga lah to ensure that the teachers are aware about all of these things as well, and to support the kids, the students that are going through, let's say, social anxiety at school, and build up that awareness lah in that sense.
I think it's not just an individual punya kerja, but a lot of pihak jugalah, a lot of different organizations have to play a role jugalah.
Correct.
So, but in all, social anxiety is something that is treatable. Kan? I can conclude that.
At least it's manageable to the point that it's manageable.
It's manageable.
They can cope
we can
better.
handle.
Yes, correct.
It's still there.
Yep,
We might feel
of
it.
course.
Kita naik pangkat ke, kita
Of
ada
course.
projek besar ke nak present, we're still gonna feel the anxiety, social situation. But it doesn't become something yang menghalang hidup kita.
Correct. At least you've got the skills and you're able to cope better. I think that's the most important thing why we want them to actually seek help. And the family supporting them when they're going through this moment in their life. Yeah.
Right. Okay. I think it's very interesting to see this from various perspectives, from and also the help from not just roles as clinical psychologists lah kan, professional, but also it can start at home.
Right.
It can start at school. So I think this is something that if we understand, daripada awal lagi kita boleh bantu, the children to build their confidence to, to manage their own anxiety if they do kan.
Yes, the earlier that we can help them, the much better in terms of the outcome lah. That they're able to get into adulthood, adulthood, they're able to manage it much better.
They can grow healthy lah kan. Psychosocial
and
development tu
exactly.
dia ikut umur dia kan.
Yeah, and thriving. I think that's the most important thing. Yeah.
Okay, thank you so much, Doctor, for your
welcome.
sharing today.
Thank you for having me.
Thank you. I think I've learned something as well today. And actually, just to share lah with our viewers kan, in Young Minds, we are actually very dedicated into doing like such things lah. Bringing awareness, cakap tentang kesihatan mental. Kita nak break the stigma. And actually kita ada buat training and we also provide free counselling. So for those out there, mungkin you have struggles and you need someone to talk to, okay, do reach out kepada Young Minds in our social media, di Facebook, TikTok, Instagram, Twitter. Just reach out if you need a safe space to talk. So we are here to support, okay? And again, I think we are never alone, right? We are never alone. Whatever that we struggle, we can find the right person to support. Yeah. Okay, thank you again, Doctor.
Alright,
I hope to see you again, insyaAllah.
InsyaAllah. Ramadan Kareem.
Ramadan
Selamat
Kareem.
Hari Raya.
Selamat Hari
Maaf Zahir
Raya.
Batin.
Alright, Assalamualaikum. See you in our next video.